Hi everyone, coming up on this week's Pet Stop, listen up cat owners. We'll tell you all about a dental health problem over 50% of cats develop in their lifetime. Plus why it's so important to spay and neuter your pet. We'll also have adoptions and pet of the week, so let's get started. Hello and welcome to the Pet Stop. I'm Dr. Brian Voynick from the American Animal Hospital in Randolph. Well, more than half of all cats over 3 years of age will suffer from a dental condition called tooth resorption. It can be a very painful and debilitating condition if it goes unnoticed. And since February is Pet Awareness for Dental Month, it's a good time to talk about the problem. My guest today is Dr. Christopher Stancel from Ridgewood Veterinary Hospital. Welcome to the show.
Thank you. Glad to be here.
You're with Dr. Dean Cerf.
Yes, I am.
We had him on some time ago to talk about transitional cell carcinoma and how he's treating bladder cancer really incredibly well.
Doing great work.
In Bergen County. So this is a huge problem. You see a lot of cats with it as well, huh?
Yes, we do. It's actually very common in cats. Actually, about 50% of cats that are greater than 3 years of age actually exhibit this syndrome. And most of the time, many pet owners don't even know that their cat has it.
Yeah, you know, it's basically, the way that I explain it is that it's a sideways cavity, because cats don't have the flat occlusal surface like we do. They have like mountain peaks, because they're obligate carnivores. They're supposed to tear apart meat. And there's a picture you brought along that shows this red lesion inside the enamel. It actually eats right through the enamel.
Yep, and it can even progress far enough where it could damage the tooth root and also cause the tooth to become
on the X-ray
loose.
shows that black is not good. You
Right.
should have nice white bone formation around the socket. So that canine tooth, that big fang tooth, is in a lot of trouble there and requires extraction.
Yes,
Unfortunately, there's no treatment for that. And pretty common, wouldn't you say?
Yes, we do. We do see it quite often, and unfortunately, many of the pets come to us when the owners notice that there's an odor or something like that coming from the mouth and don't even realize that there's disease that happens before it even gets to that point.
Yeah, I would say most of the times that I diagnose it, clients are unaware of it. You know, we always do a good, oral exam, and just as I could show you on Alan here, you just have to lift the gums and go way back, and if you can see the back molars and premolars, you could finally get a look. But in cats, interestingly enough, it's on the bottom. So it's the bottom tooth, the bottom premolar, that's typically affected, and the lip tends to stay real close to it, flat against it. There's another example picture that you brought along that shows that redness on the enamel. That's abnormal. If you guys take a look at your cats at home and see that, there's another one. Forward to the right-hand side of that dental instrument is that red lesion on what appears to be the enamel of that premolar tooth. And that is a painful condition. It's almost like chewing on aluminum foil for a human. What symptoms should they be looking for, Chris, at home?
Mainly what we're going to try to see is, or owners will see at home, is you could see excessive salivation. They might notice that their pet is drooling more than normal. They may see blood in their mouth, or they may also show difficulty eating. And they may also have pain as well, but many of them may not even show any of those symptoms at all, and it can be missed.
That's the problem. You know, when a cat stops eating, it's a huge deal, much more so than people and dogs. Explain that to us.
Well, cats have a very, very high metabolism, and when they're unfortunately not eating their food, they could often develop other syndromes as well, which could also affect their liver. Disease process known as fatty liver in cats, which is a big concern when that develops. So it's a serious thing when your cat's not eating, because it can not only be an initial problem, but also progress to
And
other
treatment
disease.
of choice?
Usually is extraction.
Yeah. I know we've had a lot of boarded veterinary dentists on the show in the past several years, and they've tried polymers, they've tried all kinds of restorative things that we can successfully use in people, but they don't seem to work. But as soon as you extract it, that pain goes away. So that's the importance of regular dental exams and questions often asked, how do you know? Like but obviously physical examination tells
physical exam, looking at the teeth, checking for signs of pain, because again, sometimes they may not exhibit that. So if we see anything abnormal, we may put some pressure on there and look for that.
And as we were talking about before, some cats are kind of fractious, and especially if you, for example, get a fractious or a cat that's just out of control and difficult to examine. Sometimes they come from the wild, and we try to rehabilitate them. it's really hard sometimes to get an exam. But we were talking about some of the safe measures that we can use, and talk about that a little bit.
Yeah, sometimes we may need to use some light sedation.
Kitty magic,
yep.
we call it.
To try to help relax them enough to be able to look into their mouth.
Yeah, and the cool thing is that it's reversible these days. You know, so it's very relaxing. It's got some pain relieving properties. And then we could reverse it with a little injection and they wake up. So it's very, very safe and very, very helpful. What do you recommend to clients as far as just regular routine care for their pet's teeth?
Mainly regular teeth brushing is actually great. You know, we encourage owners from day one with puppies and kittens to brush their pet's teeth. I'm often asked how often. You know, as often as you can do it. We brush our teeth once a day, twice a day. If that could be done that often with your pet, that would be great. In certain cases with dogs, dental bones or certain types of foods are also available that are prescription diets that could also help with some of the tartar, plus regular checkups, making sure that the teeth get looked at by your veterinarian to make sure they're where they should be.
Right, and then, you know, again, if you lift your pet's gums and you take a look at the teeth, you could just rub gently on the junction of the gum and tooth line. Some people use a toothbrush. You could also use just a gauze pad and just rub gently on the junction of the gum and tooth line like that with a gauze pad on your cat and your dog's teeth. That could be very helpful. The other thing that we use a lot of is the CET chews. Alan gets one a day. The CET chews are pretty cool because they're impregnated with chlorhexidine, these flat rawhides. And so that actually releases chlorhexidine, that antibacterial, to kill bacteria on contact, and that, you know, the cats have that Tootsie Roll shape. Do you find that effective?
Yes, it works pretty well for them.
So. Chris, it depends on the palatability. And in some cases with the extractions, we sometimes will suture, sometimes not, but always pain relievers.
Yep, definitely, because again, you know, there is pain associated with that. Depending on the level of disease, you know, you could have some pretty significant lesions in the mouth. You know, in certain instances where we do have to, you know, remove their teeth and put sutures in there, a lot of times we want to make sure the pet's not going to rub at it or try
that's
it.
an Elizabethan color we're showing, so that that cat now gets Sirius Radio and HBO as well. We hope. So, okay, good. And any other suggestions you have for our cat owning public? They're masters of disguise with disease, I always say.
They sure are. They're often, you know, many of their diseases often sneak up on them, and you know, unfortunately, they often come to us when their disease has progressed so far. So it's important for, you know, pet owners to pay attention closely and you know, make sure they get their regular checkups.
Thanks a lot. Thanks for joining us. You're welcome. Folks, still to come, the health advantages to spaying or neutering your pet, plus adoptions and Pet of the Week too. So stick around. There's more to come on the Pet Stop right here on News 12 New Jersey. Welcome back to the Pet Stop. I'm Dr. Brian Voynick. Spaying and neutering your pet not only helps to reduce the thousands of unwanted pets that end up in shelters each year, it can also benefit your pet's health. My next guest is Jane Guillaume, the clinical director at People for Animals. Thanks for being here.
Thanks for having me.
There are a lot of myths, you know, about spaying and neutering, and mention some of them, and we'll talk about it.
Okay. Probably the most common myth is that the animal will get fat.
Okay. Now the thing about that is that, yes, there is reduced caloric requirements after a cat or a dog is spayed or neutered. So what it requires is that we reduce the calorie intake. So instead of feeding them the same amount, you feed them 25 for 20% less. What's the name? Name another. That's a good one, Jane. Name another.
One of the things that most people think is, you know, what's the big deal if I let my pet breed, as long as I find a home for those kittens and puppies, the offspring that are born from that.
True.
But what actually ends up happening is, even if you find those homes, many times situations change in the future, and you can't necessarily control what they're going to do with that pet, and a lot of those animals end up in shelters.
That's true. And the other thing I mentioned to folks, Jane, is that, you know, if they have a litter of, say, you know, 10, then that's 10 more that will be euthanized in local shelters.
Exactly.
You've got 10 fewer homes that are ready to accept these pets.
Exactly. That's why we encourage people to instead of shopping, go to a shelter or a rescue group and adopt a cat or dog.
And what other myth?
Well, there are so many.
Like I'm just going to keep them inside. How about that one? If I keep them inside,
Yeah.
that'll be cool.
Well,
when they go into heat, the hormones kick in and
unpleasant.
they want to run out.
They do.
Every chance they get.
And they do. And they often are unpleasant to be with when they're in heat. If you've ever lived with a female cat in heat, you know that it's not a very pleasant thing to have to
Yeah, I'm
deal
laughing
with.
because I remember about 20 years ago, I had to come into the animal hospital on an quote-unquote emergency on a Sunday, and this poor lady thought that her cat was dying because the cat was just screaming, and the cat just happened to be in heat, just acting totally out of control. You know?
Right, it's not a pleasant thing. So it makes them a much better pet. It makes them more owner focused, so they're easier to train for dogs. Cats just tend to be, more affectionate and happier in general.
Yeah. The other thing that people should know, and it's been very well studied and talked about on this show in the past, is that if you spay a dog at 6 months of age or before the first heat cycle or before 1 year of age, there's almost a 0% incidence that dog will develop breast cancer.
Right,
and
exactly.
50% of those dogs develop, unfortunately, incurable lung cancer. So huge benefit there as well.
Yeah, there's a lot of
health-wise.
health benefits, even for male animals. Spaying or neutering a male animal prevents testicular cancer, obviously, because they're not there anymore.
Right.
Prostatitis is greatly decreased, and in general, it just improves their behavior. And as I said, it makes them more owner-focused. It makes them a better
They'll
pet.
mark much fewer trees while they're going
Absolutely,
on. Hump fewer guests coming through the door.
Right,
and
all of those behaviors.
Yeah. And the other thing is the benefit. Dogs, testosterone related, they develop tumors around their rectum. They're known as perianal gland adenomas or PAGAs, and this is directly related. And if you neuter a dog and remove the tumor at the same time, it decreases the incidence of them ever having tumors there again.
Right. So many benefits.
All good stuff. Now there's a special event coming up next week.
Right. World Spay Day is an event that the Humane Society of the United States coordinates. The actual Spay Day itself is next Tuesday, the 28th of February.
Okay.
PFA is going to be celebrating it, obviously. We're going to give away some T-shirts at the clinic and that. So we encourage everyone to give us a call and schedule your animal for spay-neuter as soon as you can.
Very, very, very important. So February is not only dental month, it's also spay and neuter.
I didn't even know it was dental month. I'm sorry, I'm very focused on spay-neuter.
No, that's okay. We just happen to be talking about cat teeth. And tell us about the kitty on your lap.
This is Daisy. Daisy was actually abandoned because she was pregnant. So another reason to get your animals spay-neutered. They get out, whether you want them to or not. So she had her kittens. All of them have been found homes. Daisy is now spayed.
And is she available for adoption?
She's available for adoption through Catitude Inc.
Catitude, okay.
Catitude Inc., yeah. It's one of the groups that we work with pretty frequently.
Great,
at the
we'll
clinic.
have that information on our website.
Wonderful.
Great.
She's
Jane.
a very sweet cat.
Okay. Very good message. And so annually, on an annual basis, you're going to be spaying feral cats. Feral cats means the cats in the wild that are not tame at all, but can be tamed ultimately with
there are estimated to be
care.
between 1.5 and 2 million homeless cats in New Jersey alone. So, and these are cats that got out, procreated, had their kittens outdoors, and those cats grew up without any socialization or human contact. So
devastating
they're wild.
to our important bird population as well.
Absolutely. So another reason to spay.
Really important to control those numbers.
But we do have, we're sponsoring an event, and we'll do it annually, where we are going to offer free spay-neuter for feral cats. We're hoping to do 80 cats this year, and we have volunteers.
And you're booked, right, this year? But
we're
next
booked
year
this year, but next year, absolutely. We do offer a discount for feral cats at the clinic on a daily basis, so
really
that's
important.
available.
Okay. Hey, thanks so much. Keep up the great work.
Thank you. Thanks for having us.
Okay. Folks, now it's time for a Pet of the Week. And these pictures were sent to us by Kevin, who rescued his dog Hank from a shelter in West Milford. Hank's 2 years old now and has lots of fun with his buddies Fancy and Little Al. Hank loves to chase squirrels and even can jump almost 8 feet high to try and catch them in trees. Kevin says Hank follows him everywhere and is just like a little person. He brings a lot of joy to his owner's life, and we really thank you for those great pictures. If you'd like your pet to be Pet of the Week, send us some pictures or videos. You can mail them to the address you see right there on the screen, or email them to thepetstop@news12.com, but be sure to tell us why your pet should be Pet of the Week. We'll be right back with this week's adoptees. Welcome back to the Pet Stop on News 12 New Jersey. I'm Dr. Brian Voynick. My next guest is Debbie Shugard from the Mount Pleasant Animal Shelter in East Hanover, and she's here with Tulip and Frankie. Great to see you again.
Thank you. Thank you very much.
You got a cute kitty. Tell us about her.
This is Frankie. He
okay.
Yes, he just came to us in the last few weeks. He came from a shelter in Newark
Oh, he's
that
a
was
good-looking dude.
overcrowded. So we were able to help them out, and he is very playful. Again, he's about a year old.
I like his hat, Debbie.
Yeah, it's cute, right? He's playful. He likes to give licks. He likes to do a little play biting, nothing hard. And he's very good with dogs. So if someone was looking for actually a companion for their dog, this guy makes a great companion.
He's very handsome.
Thank you.
Yeah, yeah. And tell us about Tulip. She is a doll. This
She
little
is
beagle
a
here.
love. Yes.
From Virginia, huh?
From Virginia. She came from a shelter in Virginia that was overcrowded a few weeks ago. She is about a year old, beagle
Great
mix.
temperament.
Excellent temperament.
Yeah.
We feel she'd make a great companion animal for a family, kids. She warms up, as you can see, pretty quickly to people. She's very people focused, very affectionate.
Yeah.
Just a great animal.
She really preferred Deb to be on my lap, and she's just leaning against me as close as she can, rather than to be on the floor. So, and how cute is she?
I know, she is just
just great.
adorable. She's
Yeah.
going to make, and she's a great size for a family. Really,
She is.
she's going to make
Nice
a
and
great.
compact.
Yeah.
Tell us about Mount Pleasant Animal Shelter. You've got quite a few dogs and cats there right now, huh,
We
for
do.
adoption.
We have about 35 cats. We have some 35 dogs. We have some puppies. We have dogs of all varieties and ages, and we have about 50 cats that are
okay.
currently up for adoption.
And as far as your needs, you can really use volunteers in foster homes, huh?
Yes, those are two of our biggest needs. We also have supplies that we can always use.
Some bleach and blankets and newspapers, and even after you're closed, you could just leave them at the front gate, right?
Sure.
And you'd be very much appreciated.
Yeah, everything goes to use right away. Cat litter, anything that folks can think of that
right,
they would
Deb.
use for their own pets.
Thanks for all you do. Keep it up.
Sure, thank
All
you.
right, you're welcome. Folks, for more information on anything about today's show or even past shows, just log on to our website, and that's news12.com. Go on features and scroll down to the Pet Stop. You'll find all the information you need right there. And that's all we have left on this week's Pet Stop. I'm Dr. Brian Voynick. We'll see you the next time. And always remember, a healthy pet's a happy pet. Bye-bye.